an average Nigerian, when you hear, or an average African generally, when you hear fever, the first thing that comes to your mind is malaria.
Like these regions where I'm telling you the vaccine has been rolled out, you can go to every village and they will tell you, like, we know somebody died of malaria. You can visit 10 households and you will be sure to find that somebody died of malaria there. So for them, when they had malaria vaccine, they really, there was no need even for it. They are like, oh, something that can prevent our children from being seriously sick, something that can prevent our children from dying, why not? So there was really no need for any incentive because they've experienced what malaria can do firsthand.
This is another episode of the Journal Conversations podcast, and it is a podcast by Nigeria Health Watch where we try as much as possible to bring insight from across the continent and from the journalists who are on the ground reporting these issues. What do we want to do with these insights? Learn from them, hear what's working, amplify these things that are working so others can learn. This is part of our cross-learning and Africa engagement work because we believe strongly that even though we are constantly pushing, we are constantly advocating, we are constantly writing, curating events around these issues, around public health. There are solutions everywhere. There are solutions in Nigeria. There are lessons from Kenya. There are lessons from Ghana, Malawi, Uganda. What can we learn from each other? That's really the essence of the Journal Conversations podcasts, because we believe there are no solutions in one place. There are solutions everywhere. And it takes deliberate efforts to find these solutions, amplify them so others can learn. So this is a remote recording. I am joining from Nigeria Health Watch office here in Abuja. So I am Director of Media Programs at Nigeria Health Watch.
My name is Chibuike Alagboso, and I am your host for today.
So I'm really delighted to have
Two wonderful guests who are joining me remotely.
and I'll just let them introduce themselves. Sharon.
Good afternoon from Nairobi, Kenya. So my name is Sharon Atieno. I'm a journalist and editor at Science Africa. This is a media house that deals with science and development issues across Africa. So basically, I'm a science journalist.
Welcome to the podcast. Afeez.
My name is Afeez Bolaji. I write for Daily Trust as a full-time writer at Daily Trust newspaper. I have been working in the media for over 10 years. Currently, I focus on education, health, and the environment as a features writer. But I also freelance occasionally for Gavi, the vaccines work. That is the news arm of Gavi, the Vaccine Alliance. Yeah, thank you for having me.
Afeez, thank you for joining us all the way from Lagos, Nigeria, and Sharon, Nairobi, Kenya. This has been a pleasure. And really, the idea, what we're going to be looking at, is something that we all know, right? Whether you live in the continent or you live outside the continent, malaria is something we are all familiar with, right? I hear that in some parts of in the West, they dread malaria, and here it's like an everyday thing, right? You have um, you have fever, you feel a certain way, and the default diagnosis you get is, oh, it's malaria, right? So it's here, it's endemic in the region, but again, we are not folding our arms. There are efforts being made to address the issue from policy perspective, from the science perspective. There are efforts being made to fix the problem. But again, there's also a conversation around vaccine. How do you even prevent it from happening in the first place? Right? Of course, there are so many ways, from the environment, human factors and all, keeping the environment clean and all. But there's also the scientific, which is where vaccines come in. How do you make sure that the body is ready to fight fight malaria parasite when it comes? And that's where vaccines come in. but we all understand the whole conversation around vaccines, adoption and all. So how do we make sure that even when the vaccines are put out there, people can accept them? And because it's one thing to supply, but if the acceptance is not there, if people are not accepting, it becomes another issue. So to throw light on how this is happening, sharing the experience from their coverage, reporting on the ground, interviewing experts. Afeez Hanafi.
Yeah, thank you so much. Like you said, malaria vaccine is a historic initiative, particularly in Nigeria. And I will be talking basically on my experience, my field experience about covering the coverage of the vaccine. So you remember
Right.
that in December last year, Nigeria rolled out um, R21 vaccines in two states, Bayelsa and Kebbi states, which are the
Mhm.
states with highest burdens of malaria in Nigeria. So I actually visited the two states to track the progress. How people are embracing the vaccines. And one interesting thing I found out in both states is that unlike other previous vaccines that uh, have been introduced to the public, the adoption, the way people embrace malaria is highly encouraging. And uh, I investigated, I probed further that why did this happen? And from my conversations, from interviews with caregivers who brought their children for their kids between 5 months and uh, 11 months for vaccination, they said, you
Right.
see, malaria is everywhere. So our children are always down with malaria and all of that. So, like you said, in Nigeria, an average Nigerian, when you hear, or an average African generally, when you hear fever, the first thing that comes to your mind is malaria. So I think, in a
Right.
way, that motivated them to come out en masse to get their
Mhm.
children vaccinated. So,
Right.
unlike other vaccines, I think the adoption, the way people turn out for malaria vaccines is exceedingly uh, encouraging.
Interesting. Thank you so much for sharing that insight. I also hear you when you talk about the reason why you think people adopted it, the prevalence. So because it's a widespread issue, so people were interested to really find a way to prevent it. So they were willing to adopt the vaccine. Thank you. Thank you so much. And we'll come back to that to hear a little bit more about the insight and some of the major takeaways from that reporting trip. Over to you now, Sharon. You did the report as well from the Kenya perspective, and pretty much looked at how it's helping eliminate malaria. Um, but that report was beyond Kenya, right? You looked at you had interviews beyond Kenya. Is that correct? Can you tell us more about it?
So about the story I did, it was focusing on a small village here in Kenya. It's called it's not even a village. It's a it's called it's a we have like different groupings of areas and regions here. So it's a sub county. It's a small part of a county. A county is like a city. It's like a state. The way you have Kano State. So now we have counties, and then now a sub state. If you have anything like that in Nigeria, so here we have a sub county. It's a small part of the county. It's like many small villages coming together and then making a sub county, and then many sub counties making up a county. So here in Kenya, we started rolling out the malaria vaccine in 2019. We were among the first countries that piloted the malaria vaccine. in 2019 alongside Malawi and Ghana. We were the three of us. So in this place, when I did this story, I visited the place where the vaccine was first piloted. It's in Homa Bay County in a sub-county called Ndiwa sub-county. So I did a story, it was like a follow-up story to find out, like, since the pilot in 2019, now this is around 5 years later, because I did it last year. So I wanted to see, is it still working or it was just a hype at that time? And what I found is that the malaria vaccine has been well adapted, and so many people have gotten used to it. It has become like a normal, any other vaccine that children take. It's just like polio, it's just like measles vaccine. It has become like a normal routine vaccine for the people who are taking it. So here in Kenya, the malaria vaccine has been rolled out in counties which are highly affected by malaria. These are counties that are in the lake region and in the coastal region, where we have big water bodies and a lot of mosquitoes in those areas. So those are the places where the vaccine has been rolled out. It's part of routine vaccination in those places. In other places like Nairobi, we don't have a lot of malaria incidences, or rather, our malaria incidences are quite low. And so it was not rolled out here in Nairobi, but in those places where there is a high incidence rate of malaria is where it was rolled out, and it has been there. They started in 2019. When they started, it had covered only 26 sub-counties, but now they after the pilot program, and they saw that it is helping to reduce hospitalization and even helping to reduce the number of deaths as a result of the vaccine, they decided to expand from 26 to now 51 sub-counties, still endemic areas. So yeah, that's it. And so I was looking at like from ground zero, let me say ground zero, where the pilot program took place. What have been the positives? What are the missing? What are the gaps that still need to be looked at? And then what are the positive things that people can learn from this rollout? And I found out that there is a lot that people can learn. So I don't know if you want me to continue from there, Chibuike, or I wait.
Thank you. No, thank you. Thank you so much, Sharon. And that's really interesting. I think something you said that really struck me is going back after 5 years, right? I
Yeah.
was just curious to know, did you report when it was initially launched in that county in 2019, or you just knew about it and now decided to follow up with the story, do a follow up last year? Because that's
So,
usually something we don't always do, because of course it's busy. You do the story and you move on to the next one. So I was just really curious to know if you how you came about
so,
doing that.
so personally, I was not there during the launch. I didn't cover
Okay.
the launch, but I do remember covering a story that touched on the launch, and people were happy about it because they were like, this is the first time something is being launched there, like a vaccine is being officially launched that is meant to help the whole world, the whole Africa. The okay, these parts that I'm talking about, these are rural areas. They are not really as urbanized as Nairobi. So for them to have like a whole celebration, it was a big deal for them. And actually, in that launch taking place there, it helped in even building trust. They were like, oh, this is an important thing that they considered us, and we are going with them through this step until this vaccine is a for them. The vaccine was a big thing, having known the devastation that malaria can cause. It was a big thing for them, and then being included when the launch was happening. It's not something that happened in Nairobi and then the drugs were taken there. The launch happened there, And then, and they saw all these people coming together, people from WHO, people from Gavi, people from the ministry coming there at the village level to launch this vaccine. It
Yeah.
was really a big deal for them.
Cool. That's really interesting. I mean, I'll come back to you, especially on the numbers, because I know the one of the things you mentioned here is how it's helping with boosting and reducing, um, sort of eliminating malaria among in children. So I was just curious to know if how the numbers were, if it's something that they actively track. So say before and after, before the vaccine rollout and when you now went back to do the story 5 years after. But just hold that thought. We'll come back to you. And Afiz, you talked about the the sort of insight, what you think drove people to accept the vaccine, the fact that this is a prevalent issue, so people were curious to adopt solution or something that could help address that issue. Because I mean, that's something that people spend a lot of money
Yes,
on,
yes.
doing tests for it, buying medications for it. But just in terms of challenges, right? Because of course nothing is really perfect. What sort of did you find out there were any issues or anything at all? Any form of resistance, right? Or maybe logistical or anything? Because the idea really is what can others learn from this? Remember, that's also, why we are driving out with this conversation. So are there things or insight in terms of logistical challenges or any form of challenge at all that others can, keep in mind? Say, imagine another African country wants to replicate, wants to launch or scale up their own rollouts.
Okay.
Any insight around that?
Okay, all right, thank you. Like I said earlier, the 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 vaccine was overwhelmingly embraced, and of course, not without a few challenges here and there. But the challenges I observed uh, were were very minimal. So one of them is getting regular power supply. Most of the, or let me say, several primary health centers where this immunization takes place don't really have stable power supply, and many of them they run on generators. And you will agree with me that cost of fuel, and then sometimes the generators breaking down unexpectedly could be problems for getting vaccines stored at the required temperature. So um, some PHCs couldn't administer the vaccines because the they don't have that capacity. They don't have regular power supply to freeze the vaccines, to store the vaccines at the accepted temperature. So what that means is that a lot of people, a lot of mothers have to uh, trek or even take public transport to far um, primary health centers to get the vaccines for their children. So it sort of discouraged some mothers who ordinarily would have visited a nearby uh, health center to get their children vaccinated. So I think the government tried to address that by giving them a token, like an incentive, to encourage them to come. But I don't think all of them, all the mothers, the caregivers who have little children eligible for immunization, get that. So, but that figure, like I said, it's very minimal. So that is one. Then secondly, we can't rule out the place of cultural belief. A few people still believed that they still have this. Uh, they still nurse vaccine hesitancy and here and there. So, but the with the help of traditional rulers, community mobilizers, imams, church leaders. I think uh, a number of communities in Kebbi were able to scale awareness in villages, in hamlets, so that in the north, particularly in the core north, men are given some level of authority. So when your husband tells you that don't take my child to the health center for vaccination, you women tend to obey. So these mobilizers tried to track men, try to track them and then encourage them, sensitize them about what the vaccine is all about, uh, its efficacy, and how and why their children should embrace it. And it actually worked, and a lot of them agreed that their children should be immunized. So those are the few challenges I noticed. Then maybe this one, if I need to add it, interestingly, some women, as they wanted to get their children vaccinated too, but their children don't fall within that age bracket. The age bracket for the eligible age for the vaccine is between 5 months and 15 months or so, if I'm right. So caregivers who have children as old as 2 years, 3 years, 4 years, they wanted to get their children immunized too. And because the doses are limited, so I think maybe it was targeted at that that tiny population, so that the the doses can at least reach a good number of children between 5 months and 15 months.
Right. Thank you. I think something you said that really that I'm interested to hear Sharon's perspective is the first thing you talked about, the token. So giving them token. I mean, I have my personal opinion around that, but I was just curious to know, Sharon, is this something you are seeing in Kenya, where government tries to encourage caregivers to bring their wards for vaccination by paying them? Whatever, maybe for whatever reason, or whatever name is given, maybe transportation, or however, but just to incentivize them to come and have those vaccinations. Is that something you are that is experienced in Kenya? And I think, what's your thought around that, really?
Okay, so here in Kenya, no, there is no token or whatsoever. There is no incentive. What the government has invested on is a lot of dialogue and public participation with community members in terms of, they call these village meetings, whereby the chief or the sub chief or the village elders, after them being sensitized, they now call for those village meetings and they tell people about the vaccine that is being rolled out, if it is a new vaccine or something like that. Also, we have something called community health promoters. So these community health promoters, what they do is, these are like the entry point to primary health here in Kenya. So you find these are people who are in charge of households within a village or a particular area, and the government uses them to do a lot of promotional messages, especially with regards to health. So what they do, they are, every time there is a rollout of maybe a new vaccine, or there is a campaign for vaccines that is going on, they are used by the government. They undergo a training. They are trained. Then after the training, they are now sent to go to the households. You find one community health promoter is maybe representing 100 households. So they go to those 100 households. They visit them one after the other. Like, they go door to door, spreading those promotional messages. So this has helped to have to create trust, because when these community members have questions, they can ask them questions that they don't know because they are from the community. They are not strangers. These are just members of the community being trained about health things, and then they are now used by the government to go door to door and send out those health messages. So what the government does is a lot of those public sensitization meetings, and then also the CHPs, because they are the focal point, they are the focal people for health health issues. And then apart from that, there is a lot of promotion. Not promotion. Yeah, promotion in terms of posters. They put out posters. They do like mass campaigns in terms of hiring. Like, do you know, like during the campaigns when every politician has hired those big speakers to announce that they are vying for a certain position, they also do that for mass campaigns.
Yes.
Okay,
Yeah, so those are
Yeah.
the
Sharon,
things
sorry for
we do.
cutting in. But do you think it's something worthwhile if something like when if a little incentive is given to caregivers, at least to mobilize them uh, to get their children vaccinated?
I think when it comes to children, people know. And then, like I said before, malaria is something that people have really experienced, and they know malaria kills. It's not like COVID when
Right.
people were sick and then they were being told somebody has died there, but they didn't see really those people going through that COVID phase. But for malaria, like these regions where I'm telling you the vaccine has been rolled out, you can go to every village and they will tell you, like, we know somebody died of malaria. You can visit 10 households and you will be sure to find that somebody died of malaria there. So for them, when they had malaria vaccine, they really there was no need even for incentive. They are like, oh, something that can prevent our children from being seriously sick, something that can prevent our children from dying. Why not? So there was really no need for any incentive because they've experienced what malaria can do firsthand.
Yes,
Interesting.
yes.
Thanks for that.
Sorry, Chibuke,
Yeah.
if I
So
can
I've
quickly jump in before you proceed.
yes,
Okay,
please.
so actually that same feeling, um, that same level of acceptance obtained in Nigeria when it was rolled out. I was just saying that government did that to further boost acceptance, and I think personally it's encouraging because uh, in a country where um, millions of people live below the poverty line of $1 to $2 per day, you could imagine what how poverty could be an impediment to getting something as important as vaccines. So if you have to trek 10 kilometers to where you will get the vaccine, it could be discouraging. You can feel, I can't do this. But if you have someone giving you a token to get that done, I think it's commendable. Perhaps that may not be, maybe health centers are located very close to communities everywhere in Kenya. No, there may not be need for that. But in some places in Nigeria, particularly in the north, you will have to trek kilometers, several kilometers before you get to where a health center is, particularly one that is administering that vaccine. So thank you. Over to you now,
Yeah,
Chibuke.
thanks for the yeah, thanks. I mean, that's totally fine because remember, this is the idea for this is to have a conversation, a general conversation, not just interview where I ask and you respond. So that was really okay. So as we wrap up, just a few thoughts and insight here and there. So Afiz, I'm interested in trust. It's something that Sharon talked about. So um how they use the community health promoters to build trust and get people to accept. But it's also something that came up in your story a couple of times. So I was just wondering, what did you sort of see or sense, right? How efforts to sustain acceptance, because it's one thing to do all the campaigns and all. Even I see it even in Kenya, similar thing happens. Like Sharon just said, the awareness campaigns and all. But trust is also not a one-off thing. It's something that needs to stay, right? Because health is also not a one-off thing. You can't predict when it comes, right? So you should be able to keep it going beyond the flag of to say, hey, we are rolling out this campaign. So, but in terms of trust, how did you get a sense of how it is, how you think they are going to be sustaining it beyond those initial flag off campaigns and rolling out the vaccine? What are your takes on that?
Okay.
Just briefly as we wrap up.
Oh, okay. Okay. So, like I said earlier on, it's good that malaria is an endemic disease that everybody that affects almost every household, particularly those in the rural areas or semi-urban areas. So so that already creates some sense of trust for the vaccine, because people are eager to get it for their children. Even I can tell you for free that if it is open to adults, many people will gladly get malaria vaccine. So that trust is there, being that malaria is endemic. But I think to sustain the trust, like you said, the government needs to do more. In this way, they need to be giving people feedback about the acceptance. If there are concerns, they should address it, because we can't rule out the fact that there will still be some rumors here and there against the vaccine. They should be quick to address those rumors, so that it won't so that people who have trusted the vaccine won't have a doubt in the long run. So and then they also need to roll out impacts of this vaccine, like Sharon mentioned earlier, that after 3 years or so, um, an evaluation conducted showed a reduction in hospitalization and uh, child mortality. So that is encouraging. If as a citizen I hear that, I tend to believe, I tend to trust the vaccine more. That okay, so this is actually saving lives and protecting children. So in a nutshell, the government needs to do more, and other partners too need to amplify the impact of these vaccines and address some concerns here and there, so that
Right.
people will, I mean, to sustain the trust people have for the vaccine, and even convince others, a few others who are still hesitant
Mm.
about it.
Awesome. Thank you so much for that, Afeez. And speaking of impacts, and numbers and storytelling, using what's already working to convince more people, to get their trust and sustain the trust of others. Sharon, I was just wondering if there were, some numbers that you saw, like I said, before and after. So did you come across such info? So what has been, because this is 5 years since rollout, that you now went to do that story. So did you get any of those insight or feedback from the people that you spoke to, around the impact of the vaccine in those communities or counties? So what was it like before? Maybe hospitalizations, or children coming down with malaria, and now 5 years down the line, is there a change? Did you get any of those you know
So, Chibuike, maybe what I can say is about the hospitalization. When I interviewed like the person in charge of the county, this specific county is called Homa Bay County, where it was first piloted. What he told me is that they've been seeing a lot of reduction in malaria hospitalization cases, and he said the number has gone up by 30,
Mm,
has gone down by 34%. So when I looked at 34%, and I looked, this is estimation from 2015. He said in 2015 they were reporting around 662,000 cases. But now that one has gone down by like
Right.
34% in terms of hospitalizations. So, and even the prevalence in that area, in that county had reduced from 27%. He's comparing with
Okay.
2015. I think 2015 is the baseline for the government. Yeah. So they compare 2015, it was at 27%. But because of, and it's not, let me just put this out there. What he said is, it is not only as a
Right.
result of the vaccine, because the vaccine does not work alone. The vaccine works in combination with other interventions. So the regular interventions are still there. The vaccine is not coming as a
Right.
super.
Right.
It's not a one fix all solution. There are other interventions that are also at play to help reduce the malaria rate. So the
Right.
children are vaccinated, yes, but they still have to sleep under mosquito nets. They still have to do residual spraying. They still have to make sure the environment is well kept. There are no stagnant water bodies or stagnant water that is open to, so, which can act as a breeding ground for mosquito. Bushes are cleared. So it's a combination of intervention.
Awesome.
So let me just make that clear.
Yeah.
So they're saying since now the vaccine has come in and it has boosted those efforts. They can see like even the severity of the disease has gone down. People are not dying as children are not dying as much. So now the biggest challenge they were saying, because I didn't mention challenge,
Oh yes.
the biggest challenge they were seeing is that here in Kenya, the vaccine is being rolled out 4 times. Like the first rollout is at 2 months, and then it's at 6 months. The vaccine is being taken in 4 doses. The first the first one is at six months. The second one is at 7 months. The third one is at 9 months, and the fourth one is at 24 months. So they were saying most parents are forgetting to come back for the 24-month one
I see.
because for routine vaccination here in Kenya, the calendar usually ends at 9 months. So for child immunizations, our calendar ends at 9 months. So once people receive the measles vaccine at 9 months, they are done.
Right.
So now this one that is coming at 24 months, after 20, like at the 24th month, they are seeing the challenge in uptake because most parents forget to bring their children. They do the 9 month and they're like, oh, they keep the book away because here when you are vaccinated, there is a book you have to like. The hospital gives you a book for the vaccinations for the child.
Yeah.
So when people reach the 9 month, they put the book away and they wait. So by the time it reaches the 24th month where they have to come back, most of them have forgotten about it.
Right. So did they share anything
Yeah.
around what they are doing? Any insight around what they are doing to um reduce that dropout?
So to reduce this, I talked about the community health promoters. So these community health promoters, what they do, it is their job to go around households, like they do routine household visits, not only when there are vaccines. They do this like occasionally, every day they do this. They go to like different households. They talk about like different things, different health issues, and key among the issues they look at is that book that I'm talking to you about, that clinic book for the child, for the under fives. So if they find there is a child there, they request the parent if they can take a look at the clinic book. And then when they see if the baby has received the vaccinations and if there is a pending vaccination, they remind them to please remember to take your child for this other vaccine that is remaining. So that's the thing that they've used. And then also there are these health talks that usually take place in the health facilities. So you will find when people visit health facilities, the morning sessions, they are usually health talks, whereby women, because women are usually the people who I don't know why they are They are the biggest number found in hospitals, but you will find most women tend to go to hospital in the morning, and even if the child is sick, it's not likely that you will find the father. Mostly you find women are there. So you find they do like those health talks early in the morning before, when the facilities are open, the health facilities. There are those health talks where they remind them, and they've also placed charts for the regular vaccines. So they have regular health talks about vaccines, and maybe if there is an epidemic that is going on, like maybe a cholera outbreak, they teach them about that. They teach them about the vaccines. They teach them on nutrition, such things. But I agree with Afeez that the government needs to do more so that people can be more aware about these vaccinations and all that.
Thank you so much. I hope they are listening. I hope they will hear the recommendations and insight from what you are, seeing on the ground, because that's really the essence of this conversation: sharing, learning, promoting cross learning as we engage with colleagues, our partners, implementers, policymakers across the continent. Thank you so much. So I'll just wrap up now. Just brief insight. We're already way past time. I'm sure my colleagues in production, when they're editing this, they're going to shout, but it's not my fault. We're enjoying the conversation. But just quickly, just to wrap up your final thoughts on what you said, and this is to you, both you and Sharon and Afeez. So something you said just now about awareness, right? And that takes me to, the space where all of us work, media, communication, and all. So yes, you reported on these issues, but what are you seeing? Are we seeing enough of these conversations? Are media organizations taking this up? Because most times it appears, or when someone is invited or when they are commissioned. But what are your thoughts around how media organizations are amplifying these things? Is it enough? And what can we do to make sure these issues continue to stay on the front burner and not pushed back? And by issue, I mean, but not just malaria, but the whole conversation around vaccination and health as a whole. Yeah, just your final thoughts as we wrap up. Just
Oh,
brief.
okay, thank you, Chibuke. Honestly, what Nigeria Health Watch is doing is highly commendable, and I can only say that
Thank
you
you.
should keep it up. So it is, the irony of it is that we know health is what affects every one of us. So, and every media organization is aware of this, but ironically, you see, in fact, it's not unusual to see a very tiny space, if at all there is any, set aside for health stories, I mean, regular health stories, not just one off. And it doesn't have to be stories all the time. It can be a kind of sensitization, education about a particular health issue. So, but beyond even reporting, organizing programs like this, where you gather people to share their thoughts, where people brainstorm, it is something that every media house should embrace, and that is the only way we can. Um, that is the only way to push this into the people's consciousness and even influence policies, positive policies that will better the lives of the public.
Great. Thank you so much for that thought, Afeez. Sharon, any thoughts? Are we doing enough? What can we do better as far as media goes? Advocacy organizations, communications organizations, putting these issues out there and staying on them, really, not just putting them out.
Okay, so for me also, I am supporting what Afeez has said. Like we should go beyond reporting based on things that have happened. For example, when it is
Right.
a launch, it is a launch of a pilot, then we forget about it. after the launch, or if it is an outbreak, we report on it during the outbreak, then we forget about it. We should make health a priority in all our reporting. So for me, I'm a science journalist, and my media house is based on science issues. So health always has a spot. But for now, for the people who are not, who their media houses have competing issues, it might be difficult for them. So I could advocate for more training, more capacity building in terms of the different health aspects, in terms of not just vaccination, but the whole health reporting thing. People can never have enough knowledge. So let there be a space where people can be trained continuously on how to cover health issues so that they know it's not just event based. Like for example, for my case, I did this malaria story after 5 years. So also let's embrace doing follow-ups. Yes, there is this Ebola vaccine that was launched. What has happened after the launch of the Ebola vaccine? Was it just meant for during that outbreak season, or there have been subsequent maybe isolated cases and the vaccine has helped, or the vaccine is not helping? Let's make health an issue that is constant. The way politics is a constant issue. When the president goes, I don't know where, we have to say, oh, the president went somewhere. So let's make health as big as that. We report on we make all aspects important, and we do those follow-ups.
Awesome. Thank you so much, Sharon. I hear you. I think something you said that really struck. So they need to report beyond events. This happened, this was launched, this was rolled out, but following up and staying on the issues. I think for me, that's one of the biggest takeaways as we share the learnings, but also how to do it better as far as media organizations are concerned. Thank you so much for sharing your thoughts and being with us in today's episode of the Journal Conversations podcast. Again, it's a product of Nigeria Health Watch in our advocacy and health communication work, especially the cross-learning and Africa engagement part of our work, where we try to bring insights, curate insights from what is happening across the continent so we can learn and adopt and also adapt. Of course, contexts are different, what others are doing to improve our continued response to all of these public health issues that we are facing. Thank you. I appreciate your time, your insight, all the way from Lagos, Nigeria. Sharon, thank you for joining us all the way from Nairobi, Kenya. All our listeners, please do engage with us. Share your thoughts around these conversations across our social media platforms. If there's a conversation you want us to have next, you can always email it to us, podcast@nigeriahealthwatch.com, or you can send us a DM via any of our social media platforms. We are very active on all of them: LinkedIn, Twitter, formerly X, formerly Twitter, Facebook, Instagram, TikTok, and also our website. Thank you, and until the next time, bye bye.